Alright, so the purpose of this video hopefully is to show the generalized grading process I go through. So first thing I'm going to do is I'm going to identify the case, put that in here, test underscore 0047. And now for the pass fail, the first thing I will do is I will click on show 3D so that it'll show up over here. And what I'm doing right now is I'm just kind of giving a big old, does this give the sniff test of, is this pretty good? And I can see the papillaries. It looks pretty good from the 3D. It looks better than I was expecting there. So pass. So now I'm moving into the grading system. And I usually don't have to mess around too much with this, but this one is the contrast seemed to be a little off. And so, you know, I'm already sort of taking notes that here in the ventricle I can see some changes. I'll toggle it on and off if I have questions, and so already I'm like, oh, there's going to be some mitral valve. This is a decent, like, I think this will have some good high numbers. So the way really I will tackle these is I will focus on axial, and so I'm going to go into, I'm just going to look at the SVC first. And so SVC right here is where it starts to separate, becomes its own thing. So I'm writing it up. It looks pretty good. There's a little bit of a gap here, but overall that's pretty good. Because there's continuity between these two vessels, but I would say this is a pass, so that's a 0. I would give it a 9 out of 10. And then moving into the IVC, coming down here, and IVC source, this is IVC here as it's coming off. Sometimes when you come down, and again it depends on the angle the patient's in the scanner, but you can see how it's kind of coming at an angle. So really I'm just kind of looking at that here, and as it goes down, that's pretty, it's pulling quite a bit in, more than most all will pull in. And as soon as the branching of the hepatic veins starts to go out, then this is now hepatic vein and IVC, and I only really care about the IVC. And so if I kind of get up to the point here, this is probably, you could, you know, IVC is here. If I trace that up, it's got this stuff at the bottom. Overall, this is an excellent IVC. I'd say it also should have been a 10, 0, but it was probably an 8, which is really excellent for that. So coronary sinus always comes in the bottom of the right atrium and wraps around. And whenever I'm looking at the coronary sinus, let's see, a nice little coronal. Let's see if I can see this here. That is all the coronary sinus coming under that left atrium. You can see it all right there. And so the thing I was going to say, this is actually pretty, it dilates out way up here, and then it kind of starts to diminish here. So when I'm saying how far would I go with this, because it's dilated, I can see it a lot further. So I would say what is a perfect 10? It would be, you know, if it was all the way over to here. But once it gets up higher there, I'm not worried about it. So if we go back to the axial, coronary sinus, like, it's obviously good. I'd say it'd be about a, I mean, it really goes around. So, but this dilation and this here, you're getting up into a bunch of other structures. That's probably subjectively where I cut it off. So I would say if I'm going to about right here, because I do have coronary arteries coming across there. You see the coronary there. So this is coronary sinus. So around here, that's still pretty good. You know, it looks very well decently demarcated, I guess. I'd probably give it a max of about 8, and then I would score it 2, because I just got really at the mouth here. So coronary sinus, and so on the pass fail, let me look back over here. I'm going to say fail. See how, like, if I saw a little thing coming around here, just evidence of it, I'd pass that. And because it's absence, that's going to be -1, 2, and 8, I think is what I said. Moving on to right atrium. So, right atrium. One thing I've found, and now this patient is sure appears to have an actual ASD, but the atrial septum doesn't always show up very well. Like this is very good. This is not a hole. And this may not. Well, we're definitely. This patient is probably a PAPVR. Is that what we're seeing? I haven't looked at it. Yeah, I think this is a PAPVR. So that's why, and an ASD, 2 defects. So anyway, so if we're focused on the right atrium, I'm curious about the right atrial appendage, how well it's captured. And again, it looks pretty good. If we're going back to this, like this tells me, oh, that's a good right atrium, right? And then over here, I come in and get into the nitty gritty of it. So I don't do too much. I won't give a 10 if there's a fake communication here, but I don't penalize it for this because it's so hard to really see on imaging. Anywho, I'd say this right atrium is probably a 10. It's a very good scan, but it's going to be about a 9. It's going to be a 9 because it doesn't get everything. So it passes. I give it a 9 out of 10. Tricuspid valve. And just so you know, I scrolled through till I got to a pretty decent scan so I could have structures to actually point out. So now, tricuspid valve. I find that I will sort of figure out what's my potential based on this. Now, like this, there's hardly any tricuspid valve here. But right here, I've got quite a bit of tricuspid valve. So my potential, I'm going to give it, this is a very good tricuspid valve, which we usually don't see. That shunting helps to maintain sort of contrast evenly distributed throughout the heart. I'm going to give this probably a 6 tricuspid valve. And so now let's look and see how much of it was captured. It's probably, and there's a little bit there. I mean, this is, number one, it's going to pass in my book because the tricuspid valve doesn't need much to pass. But that's not necessarily, like, it passes because in the model, I could figure out where, if all I had the binary mask, I'd say, oh, I can figure out where that is, even though it's probably just half. So I would give it a pass, 0, 3, 6. So I think it's probably about 30% captured, and it could have gotten up to 60% of the tissue that was there. Moving into the right ventricle. We've already seen on the 3D model, and you can always go back and look. It looks pretty good. There's a lot more sort of opportunity for more segmentation, I think. It's pretty good. Like, yeah, it's pretty good. When I'm looking at the mask here, the thing I'm looking at is there opportunity for more there? But I don't think when I turn it off and cycle it on and off, it doesn't seem as much like that in the RVOT. So it's probably a pass 9, 10. 0? Oop. Pass 9, 10. Okie dokie. Pulmonary valve. Pulmonary valve rarely shows up on the imaging. Let's see how this looks. And again, I'm going to take the contrast off to see how much I can see. And here's a little bit. That's a little bit. That's actually some of the valve leaflets as they're open. I think this may have been acquired in end systole rather than diastole. The aortic valve's not going to tell us anything about that because it's all crusted over with calcium. So I think this is probably a 2 potential. And I doubt it. Oh, see, it caught a little of that. So number 1, I'm going to call that a fail. So, and it's going to be a +1 this time because there's where I wanted absence of contrast, there actually is mask on top of it. And I'm going to give it a 1-2. Okay, pulmonary. The things that perform very well are PAs, but pulmonary veins and left atrium. So pretty good, pretty good, pretty good. There's some granularity here, and so this is excellent. I don't know. This may be a. It's 9 out of 10 or 10 out of 10. I'm gonna go 10 out of 10. 0, 10, 10. Pulmonary veins. So now I'm looking at the veins, and I'm most concentrated on stuff out here. So like the proximal, if I can see, again, right? So I can see where all those veins are coming in. Here's that one that comes in. There's the PAPBR. So I don't need to see all this stuff here. Like I'm not going to, like this is junk that there's nothing else. It's kind of cut off on probably the edge of the scan, which is why it's doing this. I'm not worried about that. I'm really just saying if I can see the proximal component of these pulmonary veins, then I'm good. And so as you can see here, they look pretty good. I'm going to go 10 out of 10. 0, 10, 10. Left atrium. Now there is an ASD in this case and the PAPBR. I think, see up in here, like do I think that could have been better? Maybe. I think it probably, we could have gotten a touch more. There may be, because it's in systole, the timing, that there may be actually some atrial contraction that's kind of given us some motion that makes it less defined. But I'm going to give it a pass 9, 10. Mitral valve. So now, turn it off. Mitral. Yeah, this is in systole because the mitral valve is closed. So that's why the mitral and tricuspid are showing up. This is like about as good as you can get. I don't know if I had very many 10s, and I don't think I'd give this a 10 because like right here there's nothing, right? And so I'm going to say the possible on this valve's a 9. And let's see. And there's certainly a lot of, so it's a pass because if you can imagine, if all I could see was that, I would say I know where that mitral valve is. So that's a pass, and it does a decent job of it. I mean, if I say it's a 9, that's maybe a 6. 6 or 7, either one. I'm kind of talking myself into a 7. 0, 7, 7. Oh, no, what did I say? 0, 7, 9. All right, left ventricle. Again, it seems like there's opportunity to, I think I would have liked to have seen some around that there a little more. So I'm going to give that a pass. 0, 9, 10. Aortic valve. Okay, so now we have, just like we had the branch pulmonary artery or the pulmonary veins with an anomaly, now we have this. I'm not counting calcium. I don't count metal artifact. So I'm looking beyond it and saying, how much of this valve do I think is here? And because it's, number one, you're probably going to have a thickened valve for the calcium to deposit on it. So there's probably quite a bit there. I'd say possible 8. I mean, there's a lot of the dark valvular tissue, like here. So, or 7. I mean, with the calcium, it kind of just makes it, so probably a 7 potential. And you can see it gets quite a bit of that. It misses where the dark on the back end go. It actually does pretty good. I may give that a 5. So aortic valve 0, 5, 7. Coronaries. All right. Coronary arteries here. So the right comes off to go anterior, and then the left comes off back here. So let's look at the right first. So I'm going to trace that up into, and it's decent. I think it could have done better. And again, let's go back here and try to peek in there and look down in. So here is that right coming off the anterior, right? So right ventricle, this is the coronary that comes off. And so it's just not impressive on here. Here is the left coming out, and I can see it doing this and this and this. And again, it seems to be underperforming. So again, let's look at the right. Wherever it's like the possible, I think once I get, so the coronary artery is going to follow the right coronary artery is going to follow the the atrioventricular groove. So it's going to fall between the atrium and the ventricle. And so once it gets around the back and starts to head down, that's when I'm going to sort of give up on it. So probably like right there. And so, you know, the possibility on this is just, you know, this right one, I'm giving it like the possibilities, maybe a 5, 7, probably 7, 6. So let's look at the left. So now I'm going to see where the left comes in. It bleeds into the pulmonary artery. I don't like that. And it branches into the LAD this direction and the circumflex this direction. The circumflex sits in the left AV groove, so the left atrium to the left ventricle groove, and the circumflex is going to come this way, and the LAD is going to go down the interventricular groove, so kind of between the right and left ventricles here. So if we just focus on that LAD, it, you know, I'd like to see it out there, but I don't know. It's just the coronaries on this just didn't turn out very well. The potential, I'm going to go a 6 on their potential, and I'm going to give it a, I don't know, a 3. I can see where the origins are, so it's sort of a barely pass. 0, 3, 6. Okay, now we are to aorta. And I have ascending and descending separated, but I still sort of score it as 1. Ascending doesn't appear to bleed anywhere into any other structures. The descending looks good. It's a 9 or a 10 out of 10. I'm going to give it a 10 out of 10. 0, 10, 10. Okay, that is this one. So now that I've scored this one, I shall submit this label. Okay, and now I'm going to do next sample, and I'll do one more. What I'm going to do is I'm going to look at it. You guys can pause. I'm not going to say what my score is until just a brief pause. That way you can kind of pause it and maybe even scroll back and forth or mute it, whatever. So this one is test 0042. First thing I'm going to do is check it out. So already it looks like a pediatric patient. I'm just curious. I don't see any major defects, so that's good. We're not fighting. If there are structures that are absent due to congenital heart disease, just put not applicable. So if there is no pulmonary artery, there is, it would be like a pulmonary arteria case, just NA, no pulmonary artery, or pulmonary valve, and that sort of thing. So anyway, so what do you guys think? I think it is a pass. Now, let's go to SVC. Okay, so I noticed that there's quite a bit of contrast in it, which gives off some artifact and some sort of beam hardening, but not too bad. Just so you can see what it looks like without it. Okay, what do you think? I think it is a pass, and it's probably a 8-9. That's what I think. So IVC, let's do IVC. I want to look back over here. IBC. Well, what do you guys think? IBC, I'm going to pass it, and I'm going to give it there's a lot of contrast in it, and when we don't, the problem there are in a lot of those adult cases where the contrast just isn't timed for the right side, but the congenital cases are probably going to have better IVC visualization. This should have been this could be hard to look at to define the structures because of the swirling of the contrast in it. I'm going to give it a potential of 9 and an actual of maybe like a 6. So 0, 6, 9. Coronary sinus. Now, coronary sinus in the pediatric cases also is usually not as prevalent. So again, it comes in on the bottom of the right atrium, so right below the left atrium. So as I go to the bottom of the left atrium, so the coronary sinus drains the coronary arteries, so I have good contrast in the coronary arteries. And if I have good contrast in the coronary arteries, there's a good chance, good chance I should have contrast in the coronary sinus. If it's there, I mean, maybe right here, I'm gonna go like, this is a fail. That's actually the artery. Maybe this is the coronary sinus here. Some dark blood returning in. So there's not much there. So that's a -1. It's a 0. I couldn't see anything on the 3D, and I would give it a 0 or 1. I mean, I'm gonna give it a 0. There's just nothing there. Nothing to visualize. All right. Right atrium. I'll try to scroll through and not show my hand so you can come up with your prediction. Okay. What do you think? I think it's excellent. I'm going to give it a 0, 9, 10. Do I want to give it a 10? You know what? Yeah, because I'm going to say this is probably in the IVC or the SVC, not necessarily. I'm going to give that a 10 out of 10. Whoever's keeping score or who said 10 and was disappointed, congratulations. Whoever's saying 9, close. Very, very good. Okay, tricuspid valve. Again, I'm going to focus first on the potential. Come up with what you think for your potential number. Okay, now let's see. So it got this one thing here. So I'm actually going to say fail and maybe a 2, but it was a good tricuspid valve. I forgot what I was going to say. I think I'm going to give it a 8. I think that's what was in my head. All right, right ventricle. So there is a VSD in this case. That's a pretty crisp border. The scan was fast enough to sort of stop the heart. There's very little motion of the trabeculations, so I have high expectations. This is also one that's in end systole. Do I think it could have done better than what it did? I'm going to give it pass 9, 10. I think it could have gotten some of this a little better in there. But being very, very fine-tooth comb. So now let's go into pulmonary valve. So looking at pulmonary valve, and we know it's pulmonary valve because that's where the branch PAs are. If this was an unrepaired TET that was different, you gotta still identify the pulmonary valve based on where the pulmonary arteries are going. Anyway, I think there's some flow. Because it's in systole, this pulmonary valve is sort of flapping in the wind. That's why it doesn't seem to be as crisp, but there is certainly quite a bit up in there. So I'm going to come up with a number for possible. And now, as we've seen in a lot of these, and sometimes now that I'm looking at how it performed, I think it's influencing my opinion a bit. Okay. I'm perseverating. Hang on. Okay, I have what I'm going to do. It is a failure, and it's a positive one because it's mask over structures I wish it weren't. And then it is a 0, but a 6. I'm already forgetting what I thought. No, 8. I said 8 in my head. 8 it was. All right, pulmonary artery. See that? That's pretty good. I've got some overlap. Do I have overlap with the veins by much? Not until I get out. Like, so I'm looking here as sort of the cutoff after it's leaving the pericardial sac area. I think it's pretty good. 0, 10. And what's interesting is I'm finding that the right ventricular side is much different on these congenital cases compared to the adult 4D cases, which we should expect. But we may find some differences there. So now we're looking at pulmonary veins. How do you like it? And I'll go back, and I was looking at this earlier, but I'll show that. Okay, I have what I like, and it is a 0, 10, 10. Left atrium. So again, the atrial appendage is a main component, one of the major components of where it sort of portends how it performed on the rest of the heart here. Here's an example. I don't know if there's an ASD or not, but that's what we can't tell. So that's why I really maybe see how there's a negative contrast. Or maybe an actual ASD in these. The congenitals, there's so much more that can be possible. That left atrium's pretty, well, what do you think? Mitral valve. 0, 10, 10. Mitral. All right. Come up with your number. Let's go ahead and lock in your, well, hang on. I'm going to go back and forth a little bit here. Okay. I've got it. So, pass or fail on this one. I'm going to fail. There's just not enough there for me to confidently say where that mitral valve is on the mask. And I'm going to give it a 2 and a 6. 2 and a 6. Left ventricle. All right, I've got my number. What do you guys got? 0, 10, 10. Aortic valve. Here we go. Okay, I've got a number for potential. Okay, I'm going to give it fail. I didn't really appreciate much at all. Could have been an 8. So, this right here is not really the valve. That's sort of where it's coming in, so that's why I didn't count that. I was looking for any evidence of anything anywhere. There's quite a bit there, it just didn't pick it up. All right, to the difficult coronaries. So let's first start here with the right that comes anteriorly. And in fact, let's go back here. Okay, looking at the right. Now I'm going to come up and look at the left main as it comes off. Okay. I'm going to have a pass and a 5 and a 7. So I think this is a pretty good one. That's why I gave it a high number, or 7's a high. But 5, like, look at all this that was missed, and it really didn't get any of the circumflex. I mean, it gets a little bit, but so yeah, 5, 7, gap of 2. Aorta. All right, I've got my number. Zero, 10, 10. And that should conclude our session. I hope this was helpful and that this serves a purpose of sort of locking in the grading for, at least for cardiac. You should be able to use this same sort of ideal for the myocardial segmentations as well. So thank you very much. I'm going to submit this label and then turn this into YouTube for you guys. Thanks.